I've not been on this side before, so it's feels very strange.
Have you done a lot of these this way, or?
I've done all of them this way.
Yeah.
So we'll see if it happens, if it works. If not, I'll have to switch with you.
Got my good side.
Okay. I'm really excited today to welcome Dr. Wojciak from Mountain Medicine here in Northern Arizona. Thank you for joining me.
Thank you.
Yeah, absolutely. So we're going to spend the afternoon talking about naturopathic medicine. It's something that I know I've told you I'm super interested in, not only for myself, but educating other folks, because I think it's underutilized, and I think if more people knew about it, they would explore it or use it for themselves and their families. Mouth for Every Year is dedicated to sharing information and educating readers and followers about different resources, tips, and tools to help them live the healthiest life possible. So that's kind of where it fits in, is again, I want to reinforce why it can help folks live a healthier lifestyle. So today we're going to talk through 3 segments, and the 3 different segments are going to cover different facets of the naturopathic medicine industry. The first is going to start with exploring the principles and background education, which I think is super important so people understand that the training a physician may have. And then we're going to go into the second segment covering treatments and what to expect. And then the last one is going to talk about how naturopathic medicine fits into the ecosystem of a patient's health care. And then I want to leave everyone with how to get in touch with Dr. Wojciak should they have any information or want to explore using. So anyway, so I've said all that, and I wanted to just welcome you again. And, just before we get started, maybe, share with us a little bit of your background and kind of share something to kind of get us started.
Yeah, definitely. I got into the medical background. If you would have asked me when I was 18 if I would have become a doctor, I would have said, heck no, there's no way.
Okay.
But I've always been in kind of the caregiving or service industry. I worked in restaurants growing up. My parents owned a couple of restaurants, and I learned, the value of customer service and helping people out and different things like that. And then for a time, I still am actually. I was a professional roofer guide full time. I still get on some trips every year. So that went from 20-minute interactions, hour interactions to 3 days to 16 days.
Right.
But the thing I always miss is that you say goodbye to these people in their short interactions, and you might have like some life-changing moments, but then their chances of you seeing them again is pretty low. So I kind of was craving something that was more impactful and more meaningful moving forward. And
so you decided to get a degree in medicine.
Yeah, so exactly.
That's very admirable.
And I knew I didn't want to go the conventional medicine route, because I've always kind of grown up more along the lines of like natural kind of stuff, doing an environmental science background and working outdoors and just knowing the value of nature and the human body. So
excellent. Well, I know that the little time you and I've spent together, you have a very kind approach, and I would assume that the naturopathic field, as I've become to be more familiar with it, it's not your traditional medicine. It takes that kinder side, that more holistic approach. So I'm excited about learning and kind of asking you lots of questions to find out more about it.
I'm excited to share, for sure.
So let's dive into the first segment. And it's a really simple question, but I think it's a great way to start. So explain to us what naturopathic medicine is.
Yeah, so you can answer this in multiple different ways, but essentially naturopathic medicine is trying to improve the health of my patients or the population in a more natural way, hence the name. So that means more lifestyle-based diet, exercise, targeted supplements and nutrients and things like that. So we're improving the entire health of the body, and then that way the body can kind of help heal itself and resolve certain issues. So instead of nitpicking tiny little things, symptom-wise, we're trying to increase the whole state of the body's health in general, so that the body can kind of take care of the other issues.
Well, and one of the things we'll kind of conclude with is how naturopathic medicine helps an individual or can help someone live a healthier lifestyle. So we're going to go through a lot of stuff to get to that, but that'll wrap it up.
Great.
And so before we get there, obviously, in this segment, I also want to know what are the principles of naturopathic medicine? I mean, is there a foundation that it's built on when you're going through education?
Right. Yeah, there definitely is. We have 6 principles, and I never say them out in line, and sometimes I forget one of them. But one of the main ones, and this goes for the medical field all in general, is first, do no harm. Of course, you don't want to harm your patients or anything.
Okay.
Second one is, doctor is teacher. That kind of is one of the main things that sets us aside. Is that we like to be an active participant with our patients, and so we provide them information and steer them in the right direction, especially nowadays when there's so much information out there.
For sure.
So we try to inform them the most we can, so that they really understand what's going on in their body and how to best fix that.
What I really like about that is it gives folks, which is I don't have written out principles for them out for every year, but my goal is to help people have the resources to make the best decision.
Exactly. Yeah.
So that's what I like about what you just said.
Right, and the more that patients know, everyone knows, the more empowered they'll feel, taking charge in their own health and everything.
Yep, for sure.
One of the big underlying things, and I kind of alluded or mentioned to that before, is the healing power of nature. So there's an innate healing nature that our bodies have. If we didn't have it, we wouldn't be able to survive as long as we have, or do as well as we've been doing as a human species. So when it comes down to it, is we're kind of the conduit to help that change, and then we just kind of get to the point where hopefully the body can heal itself. So we try to help boost up the immunity and or whatever is weaker in the patient, and just try to boost that area up so that nature can kind of take over.
Well, it's funny that you say that, because in my new book that's coming out for next year, it actually talks about treating your body as you would nourish your garden.
Right.
Really looking at it as a nourishing kind of being. Like you have plants, and people look at it from a couple different very sterile ways. I know that's maybe not the right word, but that's what I think about first. It's like, how much exercise do I need? What kind of food should I be on, and what type of medicine do I need if I'm sick? Where instead of looking at it like, how can I be living every day? And what are all those pieces? So
absolutely.
It's funny you say that, because that's kind of one of the things I'm focused on.
Right, and that's kind of one of the things that we talk about a lot of times. Like, you can't have a healthy garden unless that soil is healthy. So essentially, our health revolves around that, and that's our goal as a naturopathic doctor, is looking at your soil and making sure that it is healthy. So if it's not, then we're trying to figure out what it is that's not healthy, and we
so the being is really the rose, right? So you're nourishing the garden to make that rose bloom and look vibrant.
Right,
so
exactly.
That's exciting. Excellent. So I know a lot of people are going to want to know, and I do too. I've done a little research, but I'd love to know what type of education and background training a naturopathic doctor receives. And the reason why I say that is because I'm probably not the only one. I've seen those out there that don't have an MD or certain degrees that I would think a doctor would have. So maybe you could share that a little bit with us.
Absolutely, and that's where there's often some misunderstanding on what our education is like in the background, and then state to state, it can be different. So there are programs out there that are online programs that supposedly let you be a naturopath after a month or 2 or something of completing this online work, and then I don't know as far as what that scope means, but to be a naturopathic physician or doctor, it's a 4-year accredited program, and it's very similar side by side to regular MD schools. So you do all the anatomy and the biochemistry and the gross anatomy labs and clinical work and the physical diagnosis and all of that stuff. And then on top of that, for us, we learn not only the pharmaceutical treatments that MDs learn, but we learn all the natural treatments. Yeah, and then the natural treatments aren't just like one thing. So it's botanical medicines, homeopathy, spinal manipulations, vitamins, nutrients, supplements, and all that stuff, in different ways that you can, all the different toolbox kits. So it's like, a patient comes to me, I have multiple different ways that we could approach getting them feeling better.
So would you say that the last part of your answer is the main difference between an MD and an NMD? is that you learn the pharmaceutical side and the natural side.
As far as education wise, that's the main thing for sure.
Does every naturopathic doctor have the NMD?
The NMD? No, I believe that's pretty unique to Arizona. So I think I can't remember now, but I think naturopaths are fully licensed in about 19 states. It might be 21 now.
Okay.
And
that's good to know. I actually did not know that.
Yes, and the scope is different state by state, and so
how did sorry to interrupt, but on that train of thought, how does an individual research what? And actually, for everyone out there, I'm going to research this and put this in my blog.
Yeah.
But if you want to do it before then, how do you research what states are licensed?
What states? Yeah, the best way is to probably go to the American Association of Naturopathic Medicine website. I believe it's aanp.org.
Okay.
And they have all the information on there, scope of practice, and then from there you can shoot off and find doctors that way.
Excellent. So, I think that would be a really good resource.
Yeah, it's definitely a great resource and really important to find the right doc and know what kind of scope of practice or insurance coverage there are within the states.
Okay. So my next question is, what types of populations do naturopathic doctors typically treat? That's probably a big question, but I felt like there's got to be some targeted folks. Because it's either are you really healthy, or you're really unhealthy, or you're just somebody who's passionate about health, or you're older, younger.
We get a huge diversity of patients. So we're trained in doing acute care to chronic care to anything. But I would say usually when people find a naturopathic doctor, unless they've grown up knowing about it and have been seeing naturopaths for a while, it's after they've been to a handful of doctors and they can't figure out what's going on, and there's like a chronic condition or issue happening. That's kind of, I'd say that's kind of like the bread and butter of naturopaths a lot of the time when people usually find them.
Okay.
So because then we try to look at the whole picture and see maybe where things have been missed and then go from there.
Okay.
That's one of the key populations, and then it really depends on the naturopath. So a lot of people will focus on different areas like gastrointestinal health and things like that.
So what inspires you as a naturopathic doctor, and how long have you been practicing?
Yeah, so I graduated from the National University of Natural Medicine up in Portland, Oregon in July of 2017. So I've been practicing for just about a year out on my own, and the main thing I have been focusing on is gastrointestinal health, and it's pretty easy because as a naturopath, we all, going back to that soil analogy, is that, everyone, naturopaths say disease starts in the gut. And so if you could be eating the healthiest diet, but if your body isn't absorbing it correctly or incorporating all that correctly, then you're not going to be functioning optimally. So, and a lot, I'm sure you read a lot more like the gut brain connection and everything else, and microbiome and everything, and so
the addictions and things that we crave.
So it's unbelievable what simple dietary changes will do for people if they can get to that point and make that commitment, and it does take that time. So
in the next segment, we're going to take a break right now, but in the next segment we're going to talk a little bit more about different types of conditions and dive in, at least in a couple different areas, how to expand on those specific conditions, how patients are treated. And I think that'll be really informative because it may relate to people that are watching and listening, because it's something that they're going through.
Absolutely.
So we'll be right back, and thanks so much.
Thank you.